Hello, everyone, and welcome back. I'm Dr. Lola Ashaye, and this is part 4 of our series on connecting the dots with Dr. Ashaye, where we've been talking about perimenopause and menopause, where we've been helping women understand their bodies, their hormones, and their power during perimenopause and menopause. And today's episode is to answer a question that I had at a recent event where I was talking about this topic, and someone asked, Doc, I don't have many symptoms of menopause. I feel fine. Do I still need to think about hormones and treatments and all of that stuff? So that's what we're going to be talking about today. So let's get into it. I'm Dr. Lola Ashaye. I'm a board-certified family and lifestyle medicine physician and owner of InTouch Primary Care in Sugar Land, Texas. And you're listening to Connecting the Dots with Dr. Ashaye. So if you or your loved ones have been putting off your care due to healthcare frustrations, or you're seeking a more personalized approach to your health, I invite you to learn about our membership program. We're dedicated to making high-quality healthcare both accessible and stress-free. Okay, so over the last 3 weeks, we've talked about menopause, we've talked about what it is, we've talked about the symptoms it can show, we talked about how they can be treated, especially, that we also talked a lot about how menopause symptoms can show up in ways that are not typical, where it's disrupting sleep, mood, intimacy, energy. But what about the few people, the 10 to 15%, who made it through menopause? Maybe they only had mild hot flashes, or maybe they didn't have any symptoms at all. Should they still think about doing anything? Should they still be seeing their doctor? Well, today I want to explain a little bit more because the answer might be yes. And menopause care is really not just about treating symptoms, it's also about protecting your future health. So when we think about menopause, right, most people think about the woman holding the fan, because she's getting hot flashes, or maybe some of you may have experienced the night sweats where you wake up and the clothes are drenched in sweats. Others think about vaginal dryness or decreased interest in sex. All these are symptoms of menopause. But the reason that people have so many symptoms is because the hormones that are declining actually affect the whole body. And while some of those changes, while some of those effects are very obvious because they cause symptoms, all of us go through changes during that period. And whether the symptoms are obvious or not, changes are happening. So it'll be good to understand basically what our hormones do in the first place, because it'll help us understand why, regardless of symptoms, why it may still be useful to go ahead and have a management plan for the menopause period. So the first thing is, let's talk about the hormone estrogen. So estrogen helps protect our hearts. It helps to maintain strong bones. It helps to support our brains. It helps with skin and hair quality. So when estrogen drops after menopause, it's really not just about all those other symptoms that happen, all the effects that it had on our brain, our heart, our skin, our hair also is affected by the decline in estrogen. And so you have ripple effects across your entire body. So let's start with the heart, because the heart actually doesn't get enough attention. Heart disease is actually the #1 killer of women. It's far more common than breast cancer. And after menopause, the risk of heart disease skyrockets. And this is because estrogen, part of what it does is it helps keeps our blood vessels flexible, it lowers inflammation, it improves cholesterol. So some people may notice that after they go through the change, they start hearing that they have prediabetes and high cholesterol, and they never had that before. And that's because they've lost the estrogen protection. Also, women who start hormone therapy within 10 years of menopause lower their risk of heart disease. So it's important to know that actually a lot of people I see are so much more concerned about breast cancer or cancer in general, but the survival rate of breast cancer is now over 90%. The 5-year survival rate of heart disease after a heart attack, 50 to 60%. So we should actually be paying a lot more attention on heart disease because it's actually a much bigger issue. And that's why there's a huge focus on lowering cholesterol, lowering blood pressure, lowering diabetes, risk of diabetes, because we know that heart disease is a slow but can be silent but very, very dangerous condition. So it's important that we understand that estrogen actually plays a role in preventing it. And so we should consider estrogen in our prevention plan. All right, let's talk about the next thing. Let's talk bones. So after menopause, women can lose bone at a rapid rate, up to 20% within the first 5 to 7 years. And we know that estrogen is critical for bone maintenance. Without it, we'll see more osteoporosis. And we're worried about osteoporosis because it makes the bones so weak that they can break so easily. And when a bone breaks in a woman, especially as a woman gets older, getting around is not easy. And there's a much higher risk of death within 1 year of having a fracture in a hip in a woman that has osteoporosis. So important to keep our bones strong. And hormone therapy is still one of the most effective options for preventing bone loss. It reduces the risk of hip fracture, which can be very devastating, like I mentioned. So even if people don't feel symptoms today, taking hormone replacement may be protecting the strength and independence that a woman may want 20 years from now. So that's another thing to consider. Okay, so I want to also address one of the biggest fears when people think about hormone therapy. And one of the biggest fears is breast cancer. And that fear largely stems from a study by the Women's Health Initiative, the WHI study, which made headlines. But unfortunately, that study caused a lot of damage because it had very serious flaws. One of the biggest flaws is the patients that were in the study or the participants of the studies are very different from the participants or the patients or the people that take hormone replacement therapy now. First of all, in the study, the average age of the participants was 63. Over 50% of the people in the study had smoked or had other health risks, and many were far past menopause. So this group of women do not look like the group of women that we're talking about when we're talking about hormone replacement therapy most of the time. And since then, more recent studies have shown several things that we need to take into consideration. Number one, people that actually maybe that do not have a uterus can do estrogen-only therapy because they don't need the progesterone to support their uterus. For those people, estrogen-only therapy is associated with a lower risk of breast cancer. The other thing to consider is combined hormone replacement. So if you need to take estrogen and progesterone, which is definitely recommended for people that have a uterus to protect against endometrial cancer. While the WHI study raised concerns about potential increase in breast cancer, many experts now recognized that there are limitations in that conclusions. And more recent research has showed that when you actually start hormone replacement therapy, typically within 10 years of menopause, that risk is much lower. In several studies, actually, they suggest no increased risk. So it's using the hormone replacement appropriately at the right time. And remember, breast cancer survival is over 90%, while heart disease survival is much lower. So it's important that we look at the full picture and weigh the risks and benefits appropriately. Okay, another thing I want to talk about is bioidentical hormones, because that's another questions that we get. So what are bioidentical hormones and why are they important? So Bioidentical hormones, they're compounds that are chemically identical to hormones in the body natural produces. And they're derived from plant sources oftentimes, and they can include estradiol, which is the main form of estrogen, micronized progesterone, testosterone, and they can be prescribed in an FDA-approved formulation like patches, gels, or pills, or they can be compounded by pharmacy. So some people, when they hear bioidentical, assume that it has to be compounded by a pharmacy, but there are FDA-approved formulations. So you do not need to go to a compounding pharmacy to get bioidentical hormones. So that's number one. So many women feel more comfortable with bioidentical hormones because it's closer to what the body naturally produces, and they're generally well tolerated as well. So just wanted to put that out there. There are options, and bioidentical hormones can be prescribed safely. The other thing that I want to talk about are the lesser known benefits of hormone therapy. So many of us know it helps with hot flashes and night sweats. Many people notice that they sleep better when they are taking hormone therapy, if their sleep problem is due to menopause. But there are other things that can be helpful with hormone replacement therapy. One of those things is brain fog and memory. So estrogen supports neurotransmitters like serotonin and dopamine. Estrogen and progesterone influence mood stability and emotional regulation. When we talk about the skin, estrogen helps maintain collagen and skin thickness, so that improves elasticity and reduces dryness. Hair, many women notice thinning hair after menopause, and hormones can help reduce or slow this loss. So yes, what you've heard about hormones helping skin and hair is true and is backed with real science. So should you consider hormone replacement if you feel fine? The answer is it depends. That's a decision you want to talk with your doctor about. You want to, see when you had menopause, determine is it within the 10-year mark. You want to, figure out how old are you? Are you within that 45 to 60-year-old range? Are you looking for preventative health support, not just symptom relief? Maybe you have a family history of certain things I've mentioned today, and you're thinking, maybe I need to think about this to prevent some of these things I've seen in my family. So it's not a one size fit all. It's a personal decision that you can make with your trusted menopause specialist, not just any doctor, a doctor that is specialized in menopause care. So the point I wanted to get across is hormone replacement therapy isn't just about symptoms. It's really also about optimizing your health, your energy, and your future. So talk with a doctor who understands the nuances, who can help you weigh the benefits for you, and you can go from there. So remember, menopause is not the end of your youth or vitality. It's a transition, and it's a transition that should be highly respected and can be supported through grace. And so if you're struggling with symptoms or if you're sailing through it smoothly, you should still have this conversation with your doctor. So I hope this series has helped and that you can connect the dots in a clear and powerful and empowering way, and that you feel hopeful. And if you found this helpful, please go ahead and leave a comment, subscribe, share it with a friend. And if you're ready to talk about this transition, you can get in touch with us here at InTouch Primary Care. We provide perimenopause and menopause care. And I look forward to meeting with you. This is your time. Let's thrive.